Good afternoon, everybody. We're back with Josh and Paul and Deirdre Gifford, Public Health, and Charlene Russell Tucker, our freshly minted Commissioner of Education. This is our Back to School special. We're here at a different venue in the Legislative Office Building. We last gave you a COVID update formally in May, and we were hoping at that point that we were in the last innings of the COVID ball game. But Delta has thrown us a curve. We have some extra innings to go through. But before you say, oh my God, here we go again, I want you to know we are in so much better position as a state and as a country today than we were during that fall flare-up and where we were 14, 16 months ago. And we'll get into details of why we're better, how we're going to break the back of COVID, and what we're doing going forward. Make sure your kids can get back to school safely and you can stay at work safely. That said, I'll give you the daily summary just for old time's sake. I think it's worth noting that when you see the testing, that's 15,800 plus. That's probably half as many tests as we were doing during the peak some time ago, but twice as many as we were doing just a couple of months ago. So people are back. We have good real testing numbers, and the positivity rate 3.37%. Well, what does that mean? I can give you some perspective. A couple of months ago we were at 0.5%. So you say, oh my gosh, now we're a lot more than that. It's worth noting that we used to talk a lot about flattening the curve, if you remember. We've been at about 3.4% now for over a week. That's the 7-day moving average. Over the last 2 weeks, it's been about 3.3%. I take no great comfort in that, except we don't have the hockey stick. We have a sense that we're able to manage this infection rate. But remember, I'm less concerned about infections than I am hospitalizations, because I think that is a key metric. Hospitalizations, don't let that -4 number fool you. More importantly, we were at 50, a couple of months ago, and now we're at about 344. But that's way down from where we were a year ago. And I'll show you those numbers and what they mean in a second. Fatalities, 23. Remember, that's over a week. We now report fatalities on a weekly basis, so that's about 3 a day. It's a sad number, but it's worth noting that we have just about the lowest fatalities per capita in the country. That's incredibly important, and what that says about how we're managing through Delta. The next chart, I usually take a lens back, take a look at how we're doing compared to the rest of the country. I sometimes look at what we can learn from other parts of the world as well. It's a busy, all you got to know is the darker the red, the worse it is. And the light yellow, that means we have much, less infection there. The white blotch sort of means they don't really have their numbers together, so that doesn't mean much. You can see that Louisiana, Alabama, Florida, highly infected. Sadly, they have some higher hospitalizations and infections than they had during the worst of the COVID. Sadly, in many cases, they have hospitals in different regions who are overwhelmed or close to being overwhelmed. We're not going to let that happen in Connecticut, and that is not happening in Connecticut. You can see when you look at those states and regions a couple of things. One, those are the areas that tend to be the least vaccinated. We're twice as vaccinated as most of those areas that you see in the dark red. Thank you, Connecticut. That makes an enormous difference. And secondly, there is a certain seasonality to COVID. I think we knew that. We knew that we might expect to see a little bit of a flare-up in the fall, this coming fall. We weren't quite expecting Delta to cast that a curveball at us in late July and August. But seasonality doesn't explain everything. If you look at this map, you can see Oregon up there in the northwest. They've got some very highly infected areas, weather notwithstanding. Alaska has some very highly infected areas. Worth noting, I often look at the rest of the world as a bit of a crystal ball. Britain They got hit, let's say they're a month ahead of us in terms of where they are in the Delta, not to mention the COVID curve. And they spiked up, they went down. We thought, okay, maybe Delta breezes through pretty quickly, lightly infecting a lot of people. That sort of flattened out in Britain, so we watched that. But it's flattened out at a number that's way below where they were at the worst just a couple of months ago. Israel, I pay attention to Israel. Israel is as highly vaccinated as Connecticut. They're now administering the booster shots. And there is some breakthrough, and there you see infections going up dramatically, but a disconnect between infections and hospitalizations and fatalities, meaning people are infected, but they're not seriously infected, even in a place like Israel. More to come on that. Let's look at Connecticut. I think you've seen this chart many a time as we've been doing these over the last year. And sometimes you see all of Connecticut is bright red. And also we had nobody in the bright red just 3 months ago. So I think what you see here is bright red is where you have the highest infection rate, and the lightest colors, gray, are where you have the lowest infection rate. What do I see there? I see it's sort of interesting that southeast Connecticut, Norwich, New London, sadly, are the most infected towns at this point. Northwest Connecticut there, Salisbury and beyond, that's sort of our Vermont, as Josh would say. Much easier to social distance, so not as many people there, much more likely to be vaccinated. Other parts of the state, it used to be, maybe the cities were less vaccinated, much more vulnerable, but now you'll see some of our small towns are hit hardest. Some of our cities hit hardest, but there's no continuity there, and it's just one more reminder how important the vaccinations seem to be, and you see that reflected in these positivity numbers. This next chart, I'll speed up, don't worry, gives you an idea of what we've learned and how we've progressed. This is the COVID-19 hospitalizations. Look at March of 2020. That's when we had 2,000 people, ICUs, hospitalized, COVID-related, really high, hit hardest, blindsided. Washington was talking about hydroxychloroquine, and we were hit hard, as was New York and New Jersey. We learned a lot over the course of the next 6 months. So you see that next bump up, that was sort of November, December, January. There we outperformed our peers. Thankfully, thanks to you, because we were much more likely to wear the mask. And as time went on, we were much more likely to get people vaccinated as time went on. And that mitigated where we were compared to our peers, much lower infection rates then. And I hope you'll see the same as you see at the end of this chart, August of 2021, where at the worst we were at 2,000 people hospitalized. Today we're at 344. And I do expect that number to go up because it's a lagging indicator behind the infections. But I really believe that we're going to be much better off than we were both in the fall and as well as, early on in this pandemic. We've learned our lesson. We're best in class. And that's because we're vaccinated. Here's the vaccine update very quickly to give you an idea. 74% of our adult or 12 and over population is vaccinated. 83% of everybody an adult or have at least one dose, 18 and above. That makes an enormous difference. And that's why we're a little different in terms of protocols compared to some of the other states. Number 2 nationally in terms of number 2 in the country when it comes to a population vaccinated 12 and above. The third shots are going to be available now for the immunocompromised, those that, check with your doctor. We'll take care of you. You get that extra vaccine. You probably saw President Biden and the White House announce just in the last day or so that very soon we're going to have booster shots for everybody. The theory being that after 8 or 9 months, the efficacy of both the Pfizer and the Moderna, jury's out on J&J, begins to recede a little bit. So Deirdre Gifford is working really hard to make sure we got the vaccines in place to make sure you're ready for that booster shot. You know, we have 300 places around the state where you can get vaccinated. There's a DPH website. You'll be able to go log on if you don't have your papers that show you when you got your last second dose. You can go online at the DPH website. You'll get the information. You'll know when your 8 months is there. You'll know when you can get that booster shot. The booster shots work, and they ward off any diminution in terms of the efficacy. Boosters are recommended 600 permanent and 30 mobile locations offering you walk-up vaccines. That's important for booster shots, and you'll see that's also going to be important in terms of getting more of our people vaccinated. I will say in the start, yet again, 65 and over, 97% of everybody 65 and over is vaccinated. If 12 to 15 can match your grandparents' vaccination rate, we're over COVID. We are over. So step up and do the right thing. This is just one more chart that is a little complicated for me, but currently hospitalized with COVID-19. You can see that we got 2.3 million of our 3.6 million people in the state of Connecticut are fully vaccinated. You know, say it's 2 to 1. But I think what's important to see in this chart is as follows. You're 5 times more likely to be hospitalized and suffer complications if you're not vaccinated than if you are vaccinated. 5 times. There's some examples of breakthrough. There are 9 people who are vaccinated who are in the ICU, but that's 9 out of 2.3 million. So keep things in perspective. Sometimes the media gets everybody ginned up. And you're 10 times more likely to really suffer severe complications and go to the intensive care unit if you're unvaccinated. 10 times. This is just yet another reminder, these vaccines are working. Get vaccinated. That said, what are we going to do? We've worked hard in terms of incentives, drinks on us, front row at the concerts, bring the mobile van to you, calling, knocking on doors. And we've done very well, as you can see. Thank you, Connecticut, in terms of people getting vaccinated. But we got to do better. And here we're going to be a little stronger in terms of our medicine. You probably saw that, Deirdre told, we did an executive order, I think it was a couple weeks ago, saying, I want all the people working at the nursing homes, starting with the nurses, I want all of them vaccinated. 100%. That's a mandate. That's an obligation. And if you don't get vaccinated, the nursing home will pay a fine. And we're doing that, and I noticed that President Biden just yesterday said the same thing as a national mandate as well. I think you know why. I think you know that we were hit particularly hard in the nursing homes in terms of complications and fatalities, how important it is that every one of those nurses be vaccinated. It's for their health as well as the health of their clients. We're extending that with an executive order today. So it's not just nurses at the nursing home, but it's all state employees who work in any of our hospital facilities. Those taking care of those in need, medical need, that can be Whitney, that can be Dempsey, the others. And that's a vaccine mandate. You don't test out of that. You get vaccinated. That's the only way we can keep you safe and the patients you take care of safe. We also have a vaccine mandate that we're going to require for all state employees, K through 12 teachers and staff, and early childhood staff. That is going to represent an enormous benefit to them as well as to all the folks that they're taking care of. So it's a vaccine mandate. It becomes effective on September 27th. We've made it very easy for you. We got 300 vaccination sites all over the state. Go get vaccinated if you haven't been vaccinated. And if, obviously, there's a religious exemption, there's a health exemption, medical exemption is needed. And finally, if you're not, confident yet, you can test out and go use one of our testing facilities on a weekly basis and show that you've been tested. That's a lousy solution. The best solution is for everybody to get vaccinated. The vaccines work, they're safe. Hundreds of millions have been administered. You're going to hear very soon from the FDA. This is what I want you to do. And this is what we're following the lead of other companies around our state, and I think other companies around the state are going to now follow our lead. I want Connecticut to take the lead in terms of employees getting vaccinated. Hats off to Cigna. They have a vaccine mandate there. Our hospitals across the state have a vaccine mandate. Our universities have a vaccine mandate. Facebook, Google, Lyft, Uber, Delta, and United Airlines, they have a vaccine mandate for everybody that works there. I'll be more inclined to fly that way. These are just reminders of what we're doing. You want to go to the Bushnell, you want to go to the Foo Fighters concert at the AMP down in Bridgeport, you've got to be vaccinated. This is the way we're going to get more and more people vaccinated. This is how we break the back of COVID. In the meantime, what are we doing with our schools? As you know, we mandated that every kid in our schools, K through 12, has to wear a mask. That's for your health. That's for the health of the peers around you, and that's for everybody who works at the school. We're also mandating, as you see, teachers get vaccinated as well. We were some of the most successful in the country in getting our kids into the classroom last fall. We did it safely, and we were a template around the rest of the region and beyond. And we also know, in no uncertain terms, Charlene will be able to talk to you about this, in-person classroom education, there's no substitute for it. We're not going to have a lost year of education. So those kids are wearing that mask. And you know what that means? That means, no offense, but we're not Mississippi. Look at that headline. They just opened school in the last week or so. 20,000 Mississippi students in COVID quarantine after the first week of school. They're not wearing masks. They're not a lot less likely to be vaccinated, a lot less likely. Not in Connecticut. Our kids are going to be in school. Our kids are going to be in school safely. Our teachers are going to be able to teach safely. And you're going to be able to go to work safely. That's what we're trying to do. That's what these rules are all about. And with that, I'm happy to take your questions with Paul and Josh and Deirdre and Charlene.
News 8.
Hi, yes, it's Amber Diaz with Channel 8. Hi, Governor. Quick question for you. Do you still believe that a statewide indoor mask mandate isn't necessary in light of the latest request of 38 additional towns and cities across the state?
Well, first of all, those 38 towns and municipalities are implementing their own mask mandate. I think they know their communities very well. As you can see from the previous chart, you know, we have some places that have low vaccination rates, and I think the mask mandate is very appropriate there. We have a lot of places where, you know, 80, 90+% of the people are vaccinated. In those places, I want to give people an incentive to be vaccinated. I think it shows that if you've done that the right way, you don't necessarily have, everybody has to wear a mask. But to be blunt about it, get back to me in a week. We're going to continue to watch these numbers very carefully, and we find that we don't continue to have a flattening in the curve, that things are going up, it could change.
Governor, thank you.
NBC Connecticut.
Good afternoon, Governor Matt Austin with NBC Connecticut. In terms of this vaccine mandate, why do you think it was necessary now?
I think the vaccine mandate is necessary now because I see what's going on in Louisiana, Mississippi, Florida, and Oregon, and Alaska, and Israel. So I just thought that the more people who are vaccinated, the less targets there are for Delta or the next generation of variant to find a willing receptacle. I think it keeps us so much safer. And let's face it, we tried a lot of incentives. The vaccination rate was not going up the way it should. And I want to keep our state employees safe. I want to keep our teachers safe. And I thought now's the time to do it.
And in terms of the schools, would that apply to teachers at both public and private schools?
The answer, from my point of view, is yes. Do you want to speak to that, Charlene?
Yes, thank you, Governor. So the order right now applies to public and private schools.
Okay, thank you. And Governor, just last question, in terms of kind of the business community, there have been companies that have offered incentives to try to get workers to get vaccinated, whether a bonus or special days off, stuff like that. Had the state considered an incentive approach as opposed to going with a mandate?
I think we tried Delta. I thought was a pretty good incentive. It keeps you alive. But right now we've got the mandate, and we're sitting down. We're having good collaborative discussions with labor about how to get this done, make sure that everybody gets vaccinated. I think that's where we are.
Okay, thank you.
Channel 3 Eyewitness News.
Yes, Governor, just wanted to know what the parameters for religious and medical exemptions will be, and can long-term care employees and state employees in hospitals use religious and medical exemptions?
You want to take that, Deirdre?
Sure. Good afternoon. All of the vaccine mandates have an accommodation for a medical exemption or what we're calling a sincerely held sincerely held religious belief. So typically a provider would need to document the medical reason why a person couldn't be vaccinated. There aren't too many, there are some, but there aren't too many medical reasons why a person can't receive a COVID vaccine. And on the sincerely held religious belief, I think the details of how that will be documented will be worked out between the employer and the employees and through some collective bargaining discussions.
For the medical reasons, can you just give us one or two examples?
Can you repeat that question? It was a little garbled.
For the medical reasons, can you give us one or two examples of them?
So the most clear cut is someone who has an allergy to a component of the vaccination. But then there are some other, for example, immune conditions where the clinician may feel that it's a good idea to wait for the person to be vaccinated because of the treatment that they're on or other types of condition that they have. Sometimes those are temporary and sometimes they're permanent, but they are fairly rare.
Will workers have to pay out of pocket for tests?
The parameters of some of these details are going to be worked out with through collective bargaining in the cases of unionized employees. So that'll kind of depend on the health plan that the employee has and the agreements that they arrive out with their employer.
Thank you very much.
News 12 Connecticut. Fox 61.
Good afternoon. This is Gabby Molina with Fox 61. Just to clarify, for those that have the testing option, that's weekly testing that they'll face?
Correct.
Okay. And will there be any specific efforts to get those state employees vaccinated if they haven't been yet before that mandate begins?
You want to talk to that, Josh?
Sure. We're continuing to do educational sessions with employees where necessary. We're doing them in our correctional facilities and elsewhere for people who still have questions or concerns about getting vaccinated. And as the governor mentioned before, there are hundreds of locations around the state to walk up and get a vaccine at any time. So, for many months now, vaccines have been readily available. So we're hopeful that this is an additional nudge for those on the fence to go out and get vaccinated now.
And I'll also add from the previous question that the state of Connecticut has offered our state employees comp time for each shot that they went to go take, so it wouldn't be charged for them. We was actually providing that as an incentive that was duly negotiated and discussed with the State Employees Union.
And Governor, you had said last month, I think, that you wanted to talk to the legislature about making this decision when it came to a mandate for state employees. Is that something that ended up happening?
Yeah, no, we have had a lot of conversations led by Paul Mounds with the legislature. As you know, our executive authority, these rules last through September 30. I don't think Delta will be over by September 30. Do you want to update us on that?
Yeah, we a lot of things that are coming down from Washington, D.C., and we saw what's provided from the White House directly for additional guidance and funding opportunities for the state. We are looking at it from a legal perspective. We're going to be following directly up with legislative leaders. We had an initial conversation today, not too thorough, but we will have more thorough conversations with them in the coming weeks. As the governor has always has stated, we want to make sure that the state of Connecticut is in the best position to keep the people of the Connecticut safe. That's what these executive orders have shown and continue to show. But no matter what, we want to always be in the position to ensure that the overall safety of the state of Connecticut is in the best position.
Thank you.
Connecticut Public Media. The CT Examiner.
Hi, thanks, Max. Governor, I just wanted to follow up about the religious exemption. So, Deirdre Gifford, you mentioned that the religious exemption would be worked out. It sounded like individually. So could we be looking at different parameters for religious exemptions depending on the employer? How will that be defined more clearly?
Sure. So, the order defines it as a sincerely held religious belief. And obviously, people will be able to describe that in the way that's appropriate for their religious belief. It's not intended to be an exemption or for other types of objections, but it is meant to be for those individuals whose religious beliefs would prevent them from having a vaccination. And there will be the specific ways that an individual would describe their sincerely held religious belief is something that we will be working through the details with.
Thank you.
The Associated Press.
Thanks, Max. Good afternoon, everyone. I apologize if you answered this. It's honestly difficult to hear you guys in the LOB. So I just wanted to ask, what happens if a state employee or a teacher outright refuses to get vaccinated?
You want to take that?
Yeah, so the order will specify that for an individual who refuses to get vaccinated, or for employees who have the testing option refuse to get tested, will not be permitted in the state facility. From there, the discipline will be determined through the employee contracts, and the details of that will be worked out through the collective bargaining process with our state employee unions. Obviously, for K through 12 education, early childhood, that'll be determined and worked out between those employers as well.
Okay. Again, it's a little difficult to hear you guys. Also, maybe this is for the commissioner or the governor, but students who have family members back home with compromised immune systems, they're saying that local school districts should be allowed to provide them remote learning, just like they did in the last school year. And considering many states around the country are offering online learning academies, are there any plans to help this specific group of people and possibly to ease up on the state's remote learning restrictions?
Charlene?
Sure, thank you. And so to be clear, I'm sure you all are aware that we are implementing legislation that was passed this past session that prohibits the remote learning to occur prior to the 22-23 school year. And so we provided guidance to certainly encourage our districts to work in those individual cases so they can provide educational opportunities for students with the conditions that you just mentioned. And we continue to have these conversations with our districts, supporting them in making those decisions.
And congratulations, by the way, Commissioner. But what might those options be? Because I'm being told by a lot of the parents that they have no choice but to homeschool or to maybe sign up for some for-profit high school online.
Yeah, so districts are working individually, again, determining based on students will be in quarantine or what those immunocompromising conditions are. So they're working that through locally. But we've talked to districts who are thinking about, in some cases, tutors. Some cases that could be synchronous or asynchronous learning that's occurring. And that's why it's so important that it's really customized and specialized at the district level, as different districts have different capacity. And so that's the work that they're doing. And again, we're supporting them in how they're working that through, and we'll continue to do that. Part of this also is having districts talk with each other and sharing some of the best practices in how they're working this out.
And I'm sorry to monopolize it, but are you sure that this is actually happening? Because I'm hearing from some parents, and again, these are not kids that are immune compromised themselves, it's somebody else in the household, but I'm hearing that they're being told their districts are not offering anything to them.
And so when we get those, we follow up to ask, but keep in mind, it is not a mandate for them. It truly is a recommendation for our districts, and we're encouraging them to do that.
Okay, all right, thank you so much.
Hey, Sue, this is Ned. I would just add, give us some feedback on this. We have a number of online learning modules that we've contracted for as a state that are made available to municipalities. As Charlene, and they're broken down by grade. Charlene has said some schools are also providing tutorial support as well to do it. But the basic message is, if you can, go to class, go to school. That's the emphasis we got. We don't want to have a dual education system out there. We are going to take special care of those kids who otherwise can't get into the classroom.
Great, thank you, sir.
News 12 Connecticut.
Good afternoon. My question is about certain percentages and numbers you guys have for state employees who are currently vaccinated and how many of them still need to get vaccinated. And from your conversations with state employees, are they on board with this vaccine mandate?
Hey, Josh, do you want to start with that?
Sure. So we don't have precise numbers on how many state employees are currently vaccinated. We'll obviously get that information over the next couple of weeks through this process. But anecdotally, we hear overwhelming support for this. And as you can see in the data, the vast majority of Connecticut adults are vaccinated. So they've already made a statement very clearly with their own actions. And now we're at a position in Connecticut and around the country and the world where we look around and see a lot of people who aren't vaccinated who are sitting next to us in the workplace and next to us on public transit. And there's obviously a very strong interest in seeing further adoption of vaccines to keep all of our communities safe and our coworkers safe. So we expect very strong support from this across the workforce.
CT News Junkie.
Thanks, Max. Josh, I actually had a similar question on state employee uptake rates. Are there any agencies you know are kind of lagging behind, or other agencies you know are exceptionally have had high uptake rates? Specifically, corrections. I know that they were lagging a little while ago. Do we have any updates on that?
We were having a very hard time hearing you. Could you repeat the question a little louder?
Sure. I was asking if you know of any agencies where uptake rates have been low specifically. I know a while ago you were saying, you were saying that I think they were lagging in the correction department, but I'm not sure what if things have changed since then.
Yeah, we do believe that's one area where we are behind the average, but again, we'll have more data and we'll share that data as we collect it in the coming weeks.
Okay. Dr. Gifford, you had said earlier that as far as employees who take the, let's say the testing route, they would have to come to agreements with their employers in bargaining whether or not they pay out of pocket. Do we know what the case will be for state workers who decide to seek an exemption and then opt for testing? Will they pay out of pocket, or will that be covered?
Right now, the state employee plan does not pay for asymptomatic screening testing. So that's the current state as of today. So employees will need to seek out testing, and unless something changes, which again, this is subject to collective bargaining, they would be paying out of pocket.
Okay, thank you.
I'll just add to that I know Commissioner Gifford will be following up with the Comptroller's office on that matter directly.
The Connecticut Mirror.
Good afternoon. I heard Josh's answer about state employees, but what is the best estimate overall regarding vaccination rates among teachers as well as state employees? So in other words, what is exactly the problem, the size of the problem you're trying to address with the mandates?
Charlene, you had estimated that 75% plus of our teachers have been vaccinated. You want to speak to Mark's question?
I'm sorry, can you say that again and speak up? I'm having the same problem Sue Haig did. The folks in the LOB, your audio is very soft.
I was going to pass this over to Charlene. We have estimated that 75% of our teachers have been vaccinated, and Mark was asking about what does that say in terms of the scope of the issue.
All right, thank you. And Governor, again, can you clarify the legal authority for these mandates? Because you have mentioned collective bargaining. So is this, does this confirm that you will be seeking to extend your emergency powers beyond September 30th?
Yeah, this is, Mark, this is an executive order that has the mandate for state employees and teachers as so described. That executive authority extends through September 30. Paul has had discussions with the legislative leadership as recently as I think 2 hours ago, describing exactly what we're doing, why we're doing it. As you know, they have a committee of 6 of the legislative leaders. Anytime they want to delete or line item veto something we've done, they have the opportunity to do that or to initiate. But more importantly, this is something I want to do in collaboration with the legislature. And right now we've got it in place through September 30.
But you've also announced a statewide mask mandate for K through 12. That would also require an extension. So again, is there any doubt whatsoever that you are going to be seeking authority beyond September 30th?
I think there's no doubt about that. Either they give me the authority, they do it through legislation of their own that says this is what the rules should be, assuming we have an infection rate above a certain amount or whatever parameters we want to put on this. I think it's easiest if you give the governor's office some flexibility within narrowly defined healthcare protocols so that we can react to the Delta variant, because you see how much has changed just in the last 30 days.
CBAC issued a statement acknowledging your right to mandate vaccinations, but they also mentioned a need for overall collective bargaining on working conditions related to the pandemic. And all I could draw from that is, are they talking about trying to reopen the issue with you of remote working?
Want to take that, Paul?
No, that's not truthfully about the remote working. This is about particularly for this particular order. They have acknowledged, as we know, the governor has the authority to be able to say that the workforce should be mandated to be vaccinated. And then we've also provided for the test out option for those who opt not to be vaccinated. What this is truly about is the impact from a working condition standpoint. And so those are the discussions that will be going forward, led by our Undersecretary of Labor Relations with the Chief Negotiator of CBAC. But we are fully, and it's been shown by the courts, that the executive branch has this ability to do this authority, but we will continue to have conversations in earnest about the impacts of that. And that's what those discussions will be within.
Okay, I'll let you go, but just can you give me some examples of working conditions? What are you talking about? If you're not talking about allowing them to work from home, what are some of the possible things that would be addressed as far as their actual working conditions?
Mark, I think it's a reference to how will the testing process work? How will documentation be submitted? How will the discipline process work for individuals who are non-compliant? How does that escalate? I think it's those types of issues.
Thank you all.
The Hartford Current.
Hi. First of all, to follow up on something Paz was asking about. So just to be clear, as it stands currently, the vaccine mandate for state employees would expire September 30th. So after that, there would be no requirement, as things currently stand at this moment, that those people get vaccinated. Is that right?
afraid so.
Okay, got it. As I understand it, this order applies to executive branch and judicial branch employees. Where do things stand with legislative branch employees?
So the order will apply to executive branch employees. However, the Chief Justice has indicated that he plans to implement the same approach for the judicial branch. And we're aware that the legislature is still discussing how they'd like to proceed.
Got it. And one more thing, maybe for Dr. Gifford. We talked the other day about surveillance testing, and we got into some of the specifics. I'm just curious whether you think right now, with where things stand with the numbers in the Delta variant, whether Connecticut has an appropriate amount of surveillance testing going on right now.
Yes, well, as the governor indicated, our testing numbers are not where they were at the peak, but they have increased substantially since the low point of our infection rate in the late spring. We also are standing up, as we discussed, Alex, additional testing sites around the state so that people, we can ensure that people have access. I would also say that Connecticut has continued to be in the top 10 states in per capita testing in the country. Last I checked, which was about 48 hours ago, we were still had that status. So I think the short answer to your question is yes. I think we have adequate testing capacity in the state, but we want to make sure it's as good as it can be and that everybody has easy access to testing if they need it. And that's why we're working with our contracted testing partners to quickly stand up some additional community testing around the state. I think we have over 300 testing sites available right now, so we'll be adding to that. But we continue to outpace most of the country in our per capita testing.
Thank you, I appreciate it.
The Waterbury Republican American.
Thanks very much. I want to go back to the exemptions on this testing policy. The state law that authorizes a public health commissioner to order vaccinations during the declared public health emergency provides for exemptions for medical reasons, religious reasons, and basically conscientious objections. Why isn't that the policy that you're following now? Why should an atheist have to lie, in effect, to get an exemption?
Wow, who wants that?
We're not suggesting that anyone be untruthful. I think the allowable objections in the order, and as Paul explained, which the governor's legal counsel has determined he has the full authority to implement, allow for a sincerely held religious belief or a medical exemption that's documented by a healthcare provider. And those are well-established parameters that many other states are using for their vaccine mandates. And so that's where the governor's office landed.
But I'd like to know why there's not an exemption for someone who has a conscientious objection rather than just a religious one or a documented medical examination. You know, existing law provides for that. Why doesn't this order?
So two things for the state employees who don't fall under the hospital or long-term care workers, they have the option, if they choose not to be vaccinated, they have the option to be tested and provide results of their tests on a weekly basis. As the governor said, that's not an ideal alternative, but they would have that option. But the other answer, I think, is that the severity of COVID and the risks in some of these congregate settings merits a vaccine mandate such as the one the governor has just announced. And again, it's consistent with the way that many other states and entities are implementing vaccine mandates.
Okay, and this might be for the Commissioner of Education or someone else. What happens if a school district refuses to follow the new mask rules or this new vaccination policy?
So it's a great question. And what I will share with you is that Shipman has provided to districts a nice outline of potential consequences of defying the mask mandate. And the Superintendent's Association, I know, share that out with the school districts. And it really outlines the potential liability and duty of care that they have to perform. And so that is clearly stated for them to consider in making a decision regarding defying the order.
But could you give us some examples of what those consequences might be?
Well, some of the things that I guess this is Shipman's opinion, so we can probably share that with you so you can have it. But they talked about, potential liability if someone should become ill, in terms of making sure you have a safe space for them, right? So they're being kept safe. That's one of the things. They also shared in that opinion about federal funding that's provided to them and the potential of loss of federal funding as well.
Okay. And then what happens if a parent or an employee refuses to follow a mask rule within a school?
Our districts are really working hard, Paul, to provide some education to make sure that folks understand the need for keeping themselves and the community safe. I know that superintendents are working hard to continue to share that information with families and really hopeful that will be helpful in the decision making. We talk to students. Some of the students as well are basically, they understand why they're doing that for protecting self and others. And we will certainly continue with that education going forward.
Okay, and for Throwback Thursday purposes, I'd like to ask a Johnson & Johnson question of Josh. Could you tell us how many, or the Commissioner of Public Health, how many Johnson & Johnson vaccines have been administered? How many Pfizer? How many Moderna? Thanks.
Yeah, let's go to the next question. Give me a second to dig that up for you, Paul, and we'll come back to that.
I would say, broadly speaking, Paul, we can talk about, I refuse to wear a mask, my kid refuses to wear a mask, I want a bigger exemption so I don't have to be vaccinated, I don't think I have to be tested. The wider you cast this net, the bigger the loophole it is, the more dangerous it is for our community. The more dangerous it is for allowing our kids to get back to school safely, allow you to get back to work safely. We've done very well as a state because everybody has taken a different point of view. I'm going to do my part to keep myself safe, and that keeps my community safe. That's the type of moral suasion I hope will make a big difference.
The Day of New London.
Thanks, Max. Hi, everyone. Governor, what's your response to local leaders who say a town-by-town approach for an indoor mask mandate doesn't work because if neighboring towns don't mandate masks, it won't really stop the spread?
A couple of things on that. First of all, Rhode Island, Massachusetts, New York, none of them have a statewide mandate on masks at this point. New York, I think, is sort of interesting. They're going to say for many of these venues, you have to show you've been vaccinated. They're emphasizing vaccinations as opposed to mask mandates. So let's say New England and Northeast is not speaking with one voice. In fact, relatively few states are doing that at this point. I think, again, you've got some cities where you have a very low vaccination rate. And I can understand why, Hartford and New Haven want to take the lead in terms of making sure everybody within their confines are wearing the mask indoors. You've got other places that are 95% vaccinated. So I think I'll give a little more discretion because I think the mayors know their communities pretty well. But as I said, a couple of times now, if the world changes, if we see that flattening of the curve going up dramatically, we may have to make some changes there.
Thank you.
Hearst, Connecticut Media.
Thanks. I just want to clarify on testing. The employees they're not going to be provided testing at their work site, correct? They have to go somewhere themselves and find a testing site.
That's correct. That's our intention. Some elements of this, again, may need to be negotiated with our employee unions.
And then of the 8,000 or so state workers that are already subject to a mandate, does the state have any sense of how many of them have requested either of the exemptions, or how many may have quit, or are facing discipline because they are not complying?
What I'm hearing from the other states, Julia, is, while people are, some of the state employees, are, maybe are thinking about this, overwhelmingly people are getting vaccinated. They're not leaving work.
Yeah, but I think already for state employees in healthcare and prisons, there was essentially already a requirement, right, to get vaccinated or submit to weekly testing. So of those people, how many, do you have any sense of how many have requested one of these exemptions, or, quit over this, or? Yeah.
No, that there, up until this point, there has not been a vaccination mandate for those other state employees. There's been a testing requirement that was negotiated with our unions, I believe, last summer, for mandatory testing for some of those state employees who work in higher risk environments like our correctional facilities. But that's just about testing. That was not about vaccinations.
Okay, and if one of those workers refused to get tested, would they face any kind of discipline?
Yes.
Suspension, or what would be the discipline?
Yes, I think it initially starts with a period of unpaid leave and then results in termination.
Okay, thanks.
I think I got the signal from Max. Look, I'm not eager to do this. We're doing everything we can to keep us safe. I think Connecticut has really done very well. I think you saw from some of the previous charts how, compared to the onslaught, a year and a half ago, how much better we did in the fall and how much better we're going to do now. We are so much better positioned than we were as a country and as we were as a state. We've got the masks, we've got the vaccines, we've got the testing capacity, and we have over 80% of our adults vaccinated. Let's build on that, and that's what makes a difference, and that's what gets our kids into school safely. That's the final chart I just wanted to show you. That was Susan and I in New Britain, with the New Britain sports teams and the Bristol sports teams standing there, and all the coaches saying, I want you to be part of the team. And a teammate looks out for each other, and that's why I all want you getting vaccinated. That's how we're going to win on the playing field as well. I think we have a video that tells that story.
Please welcome Drew Crone.
Governor Lamont, Dr. Gifford, Lieutenant Governor Bicewitz, and honorable elected officials. As Mr. Lundgren said, my name is Drew Crone, an up-and-coming senior at Xavier High School in Middletown. After a long year without football, I could say my coaches, teammates, and I could not be more excited to get back on the field this fall. Due to Xavier offering a vaccination clinic held in the spring, I was fortunate enough to use this to my advantage and get vaccinated. As I stand here today at Veterans Stadium, it is my hope, along with the thousands of other high school athletes in the state, to have a chance to compete for a state title, such as football will in this very field. One way we can guarantee the safety of all that participate and a full season to occur is to take the initiative and get vaccinated if not done so already. Athletics are such a big part to many student athletes in the state, including myself, and we want to assure not only we have a full season, but also a normal school year. Football games, homecoming, prom, and other school events will be able to take place if we take the charge to get vaccinated. To all my fellow student athletes out there that have not been vaccinated yet, I encourage you to sign up and stay in the game. Thank you.
Listen to Drew. Sign up and stay in the game. Have a good end of August, everybody.